the virus and might have immunity. Here's NBC's Vicky Nguyen.
New York health officials are beginning antibody tests on 3,000 New Yorkers to see if they have possible immunity and to detect how far the virus has spread. Meanwhile, there's also a new warning about some of the rapid antibody tests available right now.
My scientific team, they basically said it's a bunch of garbage.
Sean Tabibian's diagnostic lab says it acquired rapid test kits from 5 different manufacturers, but says 70% of the tests gave inconsistent results when his team tried to validate them.
These rapid test kits are dangerous.
Why do you think they're so dangerous?
Well, because they're giving false positives or false negatives. It might give people a false sense of security that they somehow have immunity.
His lab did not look at the tests used by Denver's police and fire departments. One finger prick and in minutes, results for these crucial frontline workers.
It's critical that we have this type of information, one, to keep our workforce safe, but also to keep our community safe.
Denver's police chief says they also use a diagnostic test for confirmation and that they've seen a high level of accuracy with the antibody test they're using. But like dozens of other antibody tests now flooding the market, Denver's test has not been approved by the FDA. In March, the agency loosened restrictions, allowing companies to self-validate in an effort to speed up availability. FDA Commissioner Stephen Hahn acknowledging there are questions about accuracy.
I am concerned that some of the antibody tests that are on the market that haven't gone through the FDA scientific review may not be as accurate as we'd like them to be.
To date, the FDA has only approved 4 antibody tests. The ones Tabibian tested were not approved. Neither was the test used in a study by USC and Los Angeles County. Preliminary results suggest the virus is less deadly than first thought and more widespread, with hundreds of thousands potentially infected there compared to 8,000 initially reported cases. Dr. Anthony Fauci responding to concerns states need more antibody and diagnostic tests to reopen.
With what we have, if it is used strategically, we feel we'll be able to have most people enter into phase 1 after they pass that 14-day gating period.
Fauci also says it's reasonable to assume recovered patients have some level of immunity, but right now that's still unproven. It's also unclear how long that immunity might last.